So the study is a partnership of the National Network of Libraries of Medicine, the Middle Atlantic region. They were the folks who came up with it. At the time, they were headquartered at New York University. That contract, they recompete for the NLM contracts to serve the regions in the U.S. every 5 years. The contract has recently moved to Pittsburgh, but I do have to acknowledge those wonderful people at New York University who really got this idea in the first place and who called me up, and we formed a partnership basically to conduct the study. And of course, from the National Library of Medicine, which funds the National Network of Libraries of Medicine, they came up with some money to fund the actual study. But it's really interesting in the U.S., if you do a national study of any sort, and it's funded by federal dollars, it has to go and be approved by the Office of Management and Budget. The survey has to be posted publicly for comment and objection if anyone has something like that, but it takes at least a year for that process to happen. So we had to raise additional money, and we had to raise additional money anyway because there just wasn't enough money from NLM to do a large-scale national study, or even one in the Middle Atlantic region, which was our initial idea. But fortunately, we had very firm support from the Hospital Library section of MLA, the New York, New Jersey chapter, the Upstate New York and Ontario chapter, which had been so instrumental in the original Rochester study, and the New York Reference and Research Library Councils, which also had been funders of the original Rochester study. And very fortunately, I was just talking with Carla Funk, the wonderful executive director of MLA, who's here, and last year I was awarded the Donald Lindbergh Research Fellowship, and that is what's actually allowing us now to get the reports out to the participating hospitals and libraries, because that's turned out to be a huge amount of work and by our staff, but it's going to happen. And so I would like to thank all of those people. It takes all of us working together for something like this to happen. So this was our study team. I won't read all of the names, but I'm sure some of these folks will be familiar to you. The study team was all from the Middle Atlantic region, and then I have a number of colleagues, and I want to, those of you who are any of you in the room, there were 4 Canadian libraries that participated. Are any of you from any of those 4 libraries? Can you just read? Great, thank you. So there are, some of you will probably have questions about that too, but those of you who participated heard a lot or wanted to participate and were among the ones who were selected but maybe didn't eventually participate for various reasons. But Cheryl Thompson, and Cheryl's just wonderful. She's actually going into the PhD program in the School of Information and Library Science, and she's just a tremendous researcher, so watch for her stuff coming out. So these were the pilot sites, and what I'm going to share with you today is the pilot data. We've just finished collecting data for the full launch, and of which the Canadian studies sites were part. And those results are just being put together now, but I have some early results from that. But what I will say at this point, that even though these are pilot data, many of the findings from this are similar in nature to what will be found in the much larger full study. But you often do a pilot because you really want to see, is this going to work, and will we require any changes? And there are so many little nuances. We have, well, I was going to say, if it was in paper, a big, thick study manual that goes along with this study, which we will make available for any regions that want to replicate it in the future, plus, of course, a survey. I should just go back just for a minute and say another reason we needed all that funding from the field was that they funded the collection of the data. The survey itself had a price tag on it, the collection of the data, and that was all funded by those groups that I mentioned earlier. It wasn't funded by NLM. They supported all of the surrounding stuff and getting the reports out and all of the design part and so forth, but it was really the field itself which paid for the survey to be fielded, as we would say. So these were the pilot sites, and a lot of them are fairly large medical centers or health sciences centers, but there were also 2 smaller hospital libraries. All the pilot sites, 86 were part of a healthcare system of some sort. The Council of Teaching Hospitals in the U.S. is the group of what are considered to be the largest and most important educationally oriented hospitals. So most of them are that. Most of them, all of them were located in an urban area, but there was a mix of bed size again. But this is even more marked in the full study of 56 sites. This will, again, is only the 7 sites. So, but we have a much bigger spread because, one of the things that could be said about a study was, well, is this really representative of the whole field? But we think that the large study will be. So I always want to talk about methodology, you know all about that. It's very important in health sciences areas. So we had this pilot study, but the libraries served, actually there's 7 libraries, but they were actually serving 19 hospitals. So very often one library will have an impact in more than one clinical setting. And that survey was conducted in the fall, and then in this spring we have we're also, in addition to the main rollout of the survey with an additional 49 sites, we are doing interviews to try to pick on the nuances of the clinical situations that we gathered information about, and also particularly to probe the role of the librarian and the library in this versus the information resources themselves that people might have been searching on their own. So all of this, we use something called the sort of a collaborative way to develop survey research questions in the protocol. And we had to use listserv or portal announcement and invitation, followed by 3 email reminders. In the original Rochester study, in those days, you sent a paper letter. It was signed by the librarian and another study champion in the institution. Now, that just doesn't happen. You can't get individually, and they will not give you a list of, physicians, residents, and nurses. But so we had to go through listservs or portals, so we knew right away this would be a different study. So the thing is, that makes this study kind of interesting. And could I ask someone to give me a glass of water here? I'm just realizing I'm going to get a little dry here before I'm finished. So respondents were asked to think about an occasion in the last 6 months when they looked for information resources for patient care beyond what was available in the patient record, the electronic medical record system, or the lab results. Thanks so much. And to answer questions regarding that occasion. So the advantage of a critical incident approach is that it makes it a little different from a traditional survey where you're really looking for a strong response rate. In a critical incident study, we think that recall will be better because they're thinking about a specific incident. And we also think that if you have enough critical incidents, that you can therefore generalize from those. Whereas, as I say, with a poll or, well, they use a lot of statistical sampling techniques in polling research. But in normal survey research, and we did use a web-based survey for the main data collection instrument, it's the critical incident approach. That same thing as the Rochester study. And then now, back in Rochester study days, we just did it because we thought it was the thing to do. I've always been interested in linking research to practice. And I was a practitioner for so long. I want our research questions to be answered, and I want to work with people in the field to help address those. So, but now they call this community-based collaborative research. And this involves an active collaboration between researchers and members of the community who will benefit from the research, and it's been used very extensively in the field of public health. And if you want more references on that, one of the main authors is Israel, but if you looked up CBCR, you will find lots of stuff on that. So what was the response rate for this? It was 13%, which may not sound great, but overall, because we were dealing with so many health professionals, physicians, nurses, and residents in all of these 7 hospitals, it added up to 3,213 responses, which is a lot of critical incidents. 23% of those were physicians, 11% residents, and 9% nurses. So the response rates, they did vary by site, and we can speculate on what the reasons might be for that. But we did have a range of, with about half being, a little more than half being 10% or less, and 43% being between 11 and 26%. So, what about researchers have to tell you all these methodological details, because otherwise you won't believe the results, right? I could have just made this up. But we want you to know that it's kind of not just from a very specific group of people where it would bias the data in some way. So, we got a good split between males and females, a good split in terms of age of the respondents, and we asked people if they would be willing to be interviewed for an additional interview. Now, we thought, oh boy, we're going to be having a lot of problems. We thought we might even have to get librarians in the pilot study group to recommend people to be interviewed whom they knew had made a request to the library for information. But miracle of miracles, 206 of the respondents to the study agreed to be interviewed. Now, we do not have money to do. We're only doing probably maximum of, we've got 23 right now. I think I'd like to see us do a couple more, but we said we would do 20 interviews. But I'm really, to me, that's an indication that there are lots of people out there who really care about the value of the services that the library provides. So again, you can sort of see the range in terms of educational background. Really, this is just to help sort of confirm that it wasn't a particular group. A range in terms of years as a health professional. But you can see that there's quite a few people in there who've been in the field for more than 20 years too. That's my other areas, aging workforce, both in our field and other fields, and we're really going through a big transition there too. So we did ask people, we know that health professionals do a variety of things. They don't just spend all their time in patient care, as you so well know, but they're involved in education, in clinical research, in management or administration, and even other sorts of things within the institutions. But in order to participate in this study, people had to check, and this was a check all that apply, they had to say they actually did direct patient care or clinical research. If they didn't, they just got a very polite message back saying, thank you, but you're not eligible for the study. And we had a lot of very upset people actually saying, why can't I do this study? I really value this. And so we had the librarians explain to people that, well, you know, the survey is oriented towards patient care, and so unless you did check that, and then people would often say, well, I am involved in direct patient care with my students or whatever. So they went back and sort of did it on that basis. But this was, again, to help make sure, like, we were not trying to look at the role of the library in supporting all of these different areas. Actually, the federal library study that I mentioned that was presented at MLA, Terry Wheeler and her colleagues did try to do that. And I have to tell you, I really think it's better to be focused and to have a reason for focusing it, and to know who's the audience for the results of the research. Of course, it's us, but we need to communicate with some people about the value and look at what their perceptions are, how they would, what they would take as a valuable service, and then focus on that. But certainly the Nebraska study, the return on investment, was looking at the value in supporting research in that institution. So it's possible to do many different sorts of studies, but this one was focused on patient care. So here are the positions held by the respondents. So we actually had the highest response rate from attending physicians, and actually nurses were even just slightly higher, but as you can imagine, the number of nurses that we were drawing from was very large, so the actual response rates from the physicians were higher. So here's what you've all been waiting for, the results. So one of the main questions in the survey was, did you handle any aspect of the clinical situation differently as a result of having the information? Read outcomes, impacts. And as you can see, almost 3/4 of them said definitely or probably yes, that they did handle some aspect of the clinical situation differently as a result of having the information. And this is very similar to the original Rochester study. And when the Rochester study came out, well, we hadn't really done many. In fact, I don't know that there were any other studies at that time that had looked at this type of value of library services. It had all been those earlier sorts of things that I talked about. And it was really that Medicare, Medicaid, not funding hospital library system that drove us to this. I mean, we had to be pushed, and I guess kind of being at McMaster in those days, and Canada's always been the forefront of evidence-based medicine along with the UK. I mean, they adopted it, I would say, before the US did. But, just being in that milieu, we had people we could go to, and actually it was David Sackett himself, the big guru of evidence-based medicine. I went to him and talked about this, and he helped with this, as he did with an earlier study that I did on the impact of clinical librarianship. But I think this is one of the key results. And the participating libraries will receive slides, a slide deck that looks somewhat like this, so that you can actually use these slides for your institution and present these back to your administrators, to your audiences, use them in your newsletter and so forth. But this is, to me, one of the key results. But then how do you break down, okay, it makes a difference to patient care. Well, how does it make a difference to patient care? You have to sort of, part of research is breaking it down into its component parts.